Chronic obstructive pulmonary disease, or COPD, is a progressive lung disease characterized by emphysema and chronic bronchitis, and that both of that is going to contribute to decreased lung function. So individuals with this are going to experience chronic cough, increased sputum production, shortness of breath, exercise intolerance, muscle wasting, gas trapping due to the decreased ability to exhale, and frequent respiratory infections. So your physical characteristics of this include a decrease in the forced expiratory volume and then a forced expiratory volume forced vital capacity ratio decrease. Both of those are going to result in a decrease in exhalation force, and that's going to then further cause a decline in lung capacity. The other thing that is associated with this is airway thickening, which as the disease progresses becomes more and more of a problem. Smoking cessation is really the only intervention that has been conclusively shown to slow the rate of lung function decline in this particular disorder. So I had mentioned smoking cessation being so important, and that's due to most of the cases being caused by smoking. Other causes, just again, inhaling any type of environmental toxins, dust, fumes, smoke, of any sort can sort of contribute to this. Airway inflammation is going to play an important role, and the intensity of the inflammation is going to relate to the degree of airflow obstruction, just due to the fact that it's going to cause that thickening in the lining. So again, your white blood cell involvement here with your neutrophils, your T and B lymphocytes, again, are going to be involved in this inflammatory process. And there is a small number of cases that can be attributed strictly to genetics. So there are some genetic variables that predispose individuals to COPD. So in looking at your medications, again, review your medication table. Similar to asthma, your long-acting beta-adrenergic agonists and your short-acting beta-adrenergic agonists are both utilized for similar situations. The short-acting are used for rescue situations. The long-acting are used for kind of daily control of your symptoms. Anti-inflammatories are going to be utilized many times in conjunction with long-acting beta-adrenergic agonists to provide daily control of the symptoms. Inhaled corticosteroids are less effective on their own for COPD than just for chronic bronchitis. So typically in a situation where an individual has chronic bronchitis, they're going to be used in conjunction with the long-acting beta-adrenergic agonists. As far as the effects of exercise, so exercise capacity increases the quality of life and improves, again, just daily activities. Another important part of this is that the aerobic endurance training has been found to decrease systemic inflammation, particularly caused by C-reactive proteins and interleukin. And again, there's an observed decrease in dyspnea from exercise training in this population. Now, again, that's not going to be the result of improvement in lung function, but more from peripheral changes. So a lot of the peripheral changes that occur are going to assist with the decrease in dyspnea. It's not so much from the improvement in lung function. So your exercise recommendations, again, review the tables in the textbook, but just for some side notes, again, there's no consensus on the optimal protocol. And again, some of this just has to do with individual differences in exercise tolerance. Resistance training helps improve strength and mass, but has no measurable effects on exercise capacity, dyspnea, or quality of life, but it is recommended. Now, the one thing I will point out is obviously, the stronger someone is and the more muscle mass they can maintain, to a degree, it's going to make just daily life activities better. So while, they haven't found measurable effects on this, it's still certainly something that's beneficial. Your general recommendations for aerobic exercise, again, around 3 to 5 days a week of walking or cycling, 20 to 60 minutes per session, intensity of about 30 to 80% of peak work rate, depending on client tolerance. So again, depending on what their tolerance is kind of going to dictate exercise intensity. again, the resistance training, 2 to 3 days a week, light to moderate, 8 to 12 repetitions, 1 to 4 sets, 2 to 3 minute rest period. Again, the resistance training is still going to be important. Another thing is, again, weakness is kind of an extra pulmonary manifestation of COPD, meaning that just, strength is going to go down kind of secondary to a lot of the issues associated with the lungs. So again, that's going to show just benefits there that, again, they should be undertaking strength training as well. So chronic restrictive pulmonary disease. So this is a condition that results from restriction of lung expansion. So chronic obstructive pulmonary disease, you look at, again, issues with the actual airway and the ability of the air to go through there. Here we're looking at restrictions from the ability to actually expand the lungs or loss of lung tissue and a decrease of gas diffusion. Chronic restrictive pulmonary disease, so again, characterized by a decrease in total lung capacity, a modestly preserved forced expiratory volume, airway resistance, and a decreased forced vital capacity. And the result is the forced expiratory volume, forced vital capacity ratio greater than 80%. So individuals with chronic restrictive pulmonary disease experience an increase in effort and breathing, often due to a decrease in compliance of the lung and the surrounding tissue. So an important thing to note, this can be either caused by either an intrinsic issue, so in other words, general fibrosis from the lung parenchyma, so in other words, actually getting fibrotic tissue within the lungs, or extrinsically from some other thing that affects one's ability to expand the lungs. So in other words, a severe kyphosis, obesity, or just any other condition like that would just limit lung expansion. The impact on the pulmonary parenchyma, when you're looking at that, so the increased breathing efforts and exercise is related to a decrease or an exercise-related desaturation and a decreased gas transfer occurring in the lungs. Again, they're also going to experience the rapid and shallow breaths with dyspnea as well. So again, from a therapy perspective, again, you can start with, the non-pharmacologic route, again, avoiding any environmental irritants, stopping smoking. Again, those are important therapies. Again, stopping smoking should always be one of the first things these individuals should be looking to do if that's the contributing cause, which more than likely it'll be if someone is a smoker. And again, structured exercises, breathing exercises, anxiety management, nutrition, if we're looking at an issue with obesity, and health education would be beneficial as well. If all treatment options have been exhausted and that without attenuating the disease progression, the lung transplant would kind of be the final thing. And again, that's a last resort. And you can see here that the 10-year survival rate after transplant is 33%. Again, a lot of the issues associated with any type of organ transplant, the body rejecting the donor organ, are things that come about. So that's why if obviously that can be avoided, that's what will look to be done. Medication-wise, for chronic restrictive pulmonary disease, again, your common medications are corticosteroids, both inhaled and oral, again, to treat if there's an issue with inflammation. Again, that could help to slow any fibrosis if that's the case. Also, supplemental oxygen could be utilized to enhance oxygen perfusion. Oral corticosteroids, keep in mind, have a number of side effects. So again, kind of take a look at some of those. There's increased risks of fractures, cataracts, adrenal suppression, weight gain, long-term muscle weakness. Inhaled corticosteroids tend to be a preferred option, and with this, much like COPD, they'll potentially recommend an inhaled corticosteroid with a long-acting beta-adrenergic agonist. It's important to note that exercise capacity can be severely diminished in individuals with this due to pulmonary restriction, decreased forced vital capacity, and impaired gas exchange. So again, the medications will be used to control that. So when we look at the effects of exercise, even though exercise does not improve fibrotic damage, so if that is the cause of the chronic restrictive pulmonary disease, it won't improve that. However, it does improve, obviously, the efficiency of the cardiovascular system, and it'll also help with tissue oxygen extraction, which can lead to decreased incidence of dyspnea and a higher quality of life. So, and again, we know that the close connection between the cardiovascular and the pulmonary system. So again, the benefit there will kind of allow some decrease in things that the individuals experience. With individuals with this, we want to make sure they should be doing some type of cardiopulmonary exercise testing to find out what their exercise tolerance, and that should be a part of their diagnosis and when they're coming up with the prognosis for the individual. So this would be a situation where you'd also look to have some medically supervised exercise testing getting done, just to kind of see what the tolerance of the person is going to be at. So looking at exercise recommendations for individuals with CRPD, and again, exercise training in individuals with this can be safe and beneficial, and it can help improve some of their symptoms with their symptom management, help with their quality of life. So exercise testing should reveal the exercise tolerance. So an individual should undergo a medically supervised exercise test. And again, what this could do is it could kind of tell the intensity thresholds that an individual will be able to deal with. It'll also kind of see like what symptoms come out of that. It's typically recommended to do whole body training. Now, this will be something that'll get done as a part of their pulmonary rehab. So pulmonary rehab with whole body training is going to be a primary component. They need at least 8 weeks with two supervised sessions a week and at least 30 minutes of exercise per session. And that can be very beneficial for individuals with this interstitial lung disease associated with this. For some individuals, it'll be important to note, though, that joint pain may necessitate reducing weight-bearing exercises. So this could possibly impact during this 8 weeks. That could impact some of the exercises that they're performing, and supplemental oxygen should always be available for these individuals. Then when we look at just their physical training program, so as the textbook has shown, a 12-week physical training program has been shown to improve or maintain exercise capacity in clients that have what you'd call idiopathic pulmonary fibrosis, which would be a cause of CRPD. So again, that would be something that an individual would then be able to partake in once the medically supervised aspect of this was taken care of. Another important point to note is that in relation to the physical training program, the 6-minute walk test is a valid and responsive test about the functional status, particularly with individuals that have the idiopathic pulmonary fibrosis. So that's something to be noted as well. So again, given that this particular condition, CRPD, refers to actually many diseases that are kind of collectively grouped, again, research to determine exercise guidelines will typically focus on only one of the conditions. So again, depending upon the actual condition that's directly causing the CRPD, that's going to have a significant impact on some of the activities that you're going to be doing. But again, the pulmonary rehab, as we said, with the 8 weeks of training, that initially will be the kind of start of what can get them back to being able to participate in physical activity. Okay, so cystic fibrosis is one of the most common life-limiting genetic diseases in the Caucasian population. However, it should be noted that the average lifespan has increased drastically. So the lifespan, as you see here, from 10 years in 1960 to over 40 years in 2015. Again, obviously treatments and everything have kind of evolved, but also the ability to detect it earlier has also assisted with this as well, because obviously the earlier you detect something, the earlier you could begin then to treat it. So again, if we look at what cystic fibrosis is, it's a multi-organ system disease. So we're talking about it within the pulmonary system because it has impacts on the pulmonary system, but it does affect multiple organs, and it's caused by a mutation in a protein called the cystic fibrosis transmembrane regulator. And again, this is located on the membrane of cells and facilitates water transport. So, and if you can look here, it's actually located in the cells that line, again, many different areas. And what the issue is when that is defective, when that cystic fibrosis transmembrane regulator is defective, secretions outside the cell are not going to get hydrated with water. And then what that's going to do is cause the secretions to become thick and viscous. And what that's going to do is obstruct the organs. So, you know, whatever you see, all the different areas that get affected here, we're looking at, obviously, for our concern and what we're immediately discussing here, we're looking at the airway, but again, the pancreas, the intestine, bile duct, sweat glands, vas deferens, there's various areas that are affected by this. Your symptoms that are going to be with this include sinusitis, you know, repeated sinus infections, a slow destruction of the pancreas, and intestinal obstruction are going to be some of the things that occurs with this. Now, while we look at this being kind of a multi-system disorder, the pulmonary disease is going to be the leading cause of mortality and morbidity in individuals with this. So the airways, as those secretions are no longer are able to get hydrated, they become, again, very thick and viscous. The airways become inflamed, and that leads to many bacterial infections. Again, we're looking at airway symptoms. Coughing, wheezing, hyperreactive airways are common symptoms that gradually become worse as the disease continues to progress. So as far as medications and therapy for this, so chest physiotherapy, which involves controlled active breathing and coughing exercises, and the idea there is to mobilize the secretions, and that's going to be one of the important things in just kind of managing, you know, keeping the airway as healthy as you can, and kind of keeping that cleared out and allowing those secretions to get mobilized so that they're not, you know, blocking and causing obstructions in the airway. Inhaled hypertonic saline helps to clear the secretions further. Inhaled Dornase alpha also reduces the secretion, the viscosity of the secretions. Again, that's going to be a really important part in managing this. And again, anti-inflammatory medications and antibiotics are just going to be used to treat inflammation and bacterial infections that could occur as a result. So some other things to consider, the nutritional status is of great concern with individuals due to the fact that, you know, again, because of the impact on the pancreas and digestive system, you're going to have issues with malabsorption of fats, which is going to impact vitamins, minerals. That's all going to be another symptom associated with this. So again, when we look at some different things that could be considered on that end, oral pancreatic enzymes, fat-soluble vitamins, high-calorie supplements are generally going to be given to individuals with this just due to their generally low nutritional status. So again, while we're talking about this in regards to, you know, kind of in the category of pulmonary disorders, cystic fibrosis is going to impact other areas of the body, so it'll be important as a part of an individual's treatment regimen that gets addressed as well. So if we look at the effects of exercise, again, individuals with cystic fibrosis are typically less active than healthy individuals, but certainly, again, exercise could have a very positive effect on many of the things associated with it. So again, along with kind of the daily kind of treatments that they're doing, you know, kind of coupling some added physical activity with this can certainly help. It is important to note, though, CF is going to limit the ability to exercise due to lower lung capacity and dyspnea, And dehydration is also much more likely due to hyponatremia and decreased thirst drive. Okay, so hyponatremia is low sodium levels, and again, so the dehydration is going to be more likely because of that, and also due to the fact that individuals aren't going to be as driven to drink and to consume as many fluids. So as far as exercise recommendations, again, really important would be baseline testing to make sure that, again, for effective programming and to kind of just determine an intensity when coughing and other symptoms would occur. So again, some type of baseline cardiopulmonary exercise testing with individuals before beginning a program would be really important. And again, the cardiopulmonary responses to exercise, including, again, the intensity and duration of exercise before the onset of coughing or other symptoms, baseline maximal heart rate, and a goal rate of perceived exertion could be another thing. So you could kind of see where their perceived exertion is at as a part of the initial assessment. And another part of the initial assessment should look at their posture, their spinal alignment, and trunk muscle control. And that could allow for proper exercise prescription, because individuals with this, they'll have a little bit more trouble with their abdominal muscles at lower workloads, particularly early in the respiratory cycle, and at a higher recruitment level than healthy individuals. So looking at the neuromuscular control of the muscles at the trunk is going to be another important thing to look at. Also, again, looking at the alignment of the spine, the shoulder, the scapula, the rib cage is going to be very important for these individuals. Again, look at over the overall exercise recommendations for these individuals. Again, exercise should include 3 to 5 days a week of walking or cycling at an intensity of 40 to 70% of their peak heart rate. And again, you could kind of see where they would be at based upon their initial testing. Allow for about 30 minutes in the target heart rate range. So once they get in that heart rate range, kind of allow for about 30 minutes in that range. That'll do that. Exercise, look at the RPE, and again, the ratings of perceived exertion could kind of be utilized as a part of their testing to kind of see where they're at, to make sure that the intensity of exercise is not that high, and make sure to do a cool down period for these individuals. So, and again, look at some of the other exercise recommendations as far as on table 5.8. These kind of give you an idea. Again, a lot of your pre-exercise testing, like with many of the other conditions in particular, could kind of guide you in determining, again, when their symptoms would come on, and what exercise intensity might start to be a little much for them. So, and then you have your objectives. So again, make sure to look at, again, be aware of the physiological and physical characteristics of all these different conditions. Make sure to just kind of know and understand the pathology associated with them, what exactly is going on with the individual conditions. Again, make sure to look at the major signs and symptoms. Again, many of the signs and symptoms are obviously, very similar, but again, when you start to look at some of these other conditions, for instance, like I mentioned with cystic fibrosis, you're starting to look at other organ systems aside from just the pulmonary system being involved. Again, look at your medication group, so be able to recognize medications and categories of medications as it relates to what gets utilized for the various conditions. And again, look at the various exercise protocols. Look in cases where medically supervised testing is necessary, and can give important information as far as the intensities and everything involved for these individuals. And again, just some of your things to look at, particularly when you're talking about the need to terminate exercise for individuals with the various conditions.